Hi, it's Anita Coleman from Dr. Coleman's office, and I'd like to prepare you a little bit for your upcoming evaluation for oral ties. Dr. Coleman is very patient and gentle, and he'll invite you in and do an oral exam. He examines 4 or 5 out of the 7 oral ties we have in our mouths, but usually these 4 and sometimes the 5th are the ones that cause difficulty for people in their life. What's in the mouth is part of a continuous fascious system that goes through and around the cranium and out through the peripheral body. So some people complain of headaches, migraine headaches, tension headaches, muscle tension as the shoulders and neck are sometimes filled with tension. Earlier in life, it can malaffect nursing and feeding and swallowing and breathing and speaking. So the typical concerns with speech are the letter R sound, hard G, hard K, sometimes lateral L and S and TH. So when you first come in to see Dr. Coleman, he will do a functional analysis and a detailed location analysis with a lot of details. So you will leave our office with raw, objective data, and it should be that data along with what he sees that gives rationale for releasing. If you need the procedure, you will lay on a lowered dental chair. He uses injectable anesthetic if you're over 6 months of age, and the procedure itself then isn't uncomfortable. Post-procedure, then you're expected to do post-frenotomy therapy, and I'm going to demonstrate all of the ones that could be possible. We recommend that you do them 4 times a day: breakfast, lunch, dinner, bedtime, for a full 30 days, and sometimes beyond if you feel some of the up and down tension, relaxation, tightness, relaxation that can last a little bit longer. So here's what they look like. For the lip, if you happen to have a lip tie, you would slide underneath the lip, lift it as high as it'll go, and stretch laterally left, right, left, right. I rub a little on the outside to help it heal flat. And then with coconut oil as a lubricant for the next part, if you're not allergic to coconut, put some on the pad of your finger, and then you're going to put your fingernail near your teeth, slide up and hold. 1 Mississippi, 2 Mississippi, 3 Mississippi seconds. You'll feel your nasal bone through the skin, but you don't push hard. It's just that nice dramatic lift for 3 seconds. Occasionally, people have cheek ties where a C-shaped tension connects the top jaw to the bottom jaw. That exercise, if you would need that one, looks like this. Lift, 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 and hold. 3 slow seconds. So you're lifting your cheek out toward the outer corner of your eye in a nice big lift. So again, on this side, it's loop, loop, loop right up the diamond that would be there, and hold for 3 seconds on the other side. If you have a tongue tie, the diamond-shaped opening of freedom that would be under your tongue, you would go side to side laterally with a downward push like the letter U. Left, right, or three or 4 times with deep pressure sliding outward. Then you would want to go from the front of the diamond to the back like the letter J. And hold. Most adults prefer with the 2-finger method like this. And you're going to hold for at least 5 slow seconds. So you want to go to resistance. After the procedure's over, you won't be in any discomfort because the nerve endings are silented with his wonderful laser. And you will have had injectable anesthetic too that lasts for about an hour or so. But after that, we want you to take a combination of acetaminophen and ibuprofen. So when you get home, you'll take the acetaminophen, put it in the back on your counter, set your timer for 3 hours, and then it's eligible for the ibuprofen, and then put it in the back. So you're alternating every 3 hours, giving yourself pretty constant dose, except in the middle of the night, unless you wake up. And then most of the time, it's the first few days you might feel discomfort. And then again, sometime within the first 10 days, as muscles start working that never worked before, you may feel muscle tension and discomfort. We always recommend body work before and after meeting with us. So it can be occupational therapy, cranial sacral therapy, chiropractic that's familiar with this oral tie tension. That lessens the tightness in the peripheral fascia so that there can be a more complete release. And then we recommend it again after so that you make sure you have total relaxation. We can make recommendations if you don't personally have someone in your area that fits that criteria. So by the next day, in the surgical sites, you would have white, yellow, sticky scabs. Those are nature's Band-Aids, God's Band-Aids. They slowly can go away over the first 3 weeks, and then they're gone, and you will have new frenulums, but they'll be in the right place and long and stretchy because you're doing this therapy. Occasionally, there can be a little bleeding on the edges of the diamonds, but it's never even a drop. It's a smear where it slightly had reattached in the very first couple of days. I think I've said it all, so I wish you all the best.